Well, hello, everybody. Welcome again to our Start or Sit podcast. I'm joined here by Dr. Hawkins, orthopedic surgeon. I'm Shannon O'Kelley. I'm a physical therapist. What we do here, we talk about the previous week's injuries and whether that player is going to start or sit. This is for all you fantasy football players out there. You can pick your lineup based on the information you receive from us today, going into week 13. Can you imagine that? Week 13 already. Where's the season gone? What do we got? About 5 or 6 games left for most teams? Is that about right?
Yeah, that's it. And now with that one extra game, we get one more week out of the season.
Yeah, one more week. It's been a great season so far. Here we go. Let's get started. Let's start with a running back for Jacksonville. He has a foot sprain, and that's Travis Etienne. Travis Etienne, foot sprain. What do you know about that foot sprain?
Well, he's got an interesting history in that he actually had a Lisfranc injury earlier. So one of the concerns here was this a recurrent problem? But it's actually his other foot, and this looks to be a lateral-sided sprain. So when you look at these foot injuries, the Lisfranc involves the medial or the inside part of the foot, which is a more fixed area, not as flexible. So if those ligaments get injured, that really, really compromises the ability to plant and push off. The outside part of the foot, the bones are more mobile in the middle of the foot. And so when you sprain that area, that's a little bit more like spraining the outside part of your ankle. As long as you allow the soft tissue to heal, you can usually bounce back. So it's kind of like the equivalent of the low ankle sprain versus the high ankle sprain. So they were concerned. They got imaging done, but it did not involve his Lisfranc joint. So he looks like he'll be playing, but I think he's one of those guys, because he's a running back, his output may not be as much as normal.
Okay. So he's got this lateral foot sprain. It's not a Lisfranc, which is good, but he does have a history of a Lisfranc on the opposite foot. He is a running back, like you said. He has to plant start. We'll have to keep an eye on him. So the guess here is he's going to play, but his output could be questionable. So that's Travis Etienne, running back, Jacksonville. He is a play right now, as we that's what we're thinking, okay? Let's see. Next up, here's a big name. I watched this game. I saw this hit. Aaron Rodgers. Aaron Rodgers, quarterback, obviously, Green Bay Packers, having kind of a, tough season, I think, for Aaron Rodgers anyway. He took a hit. And he was, if I remember right, he was trying to throw, so his arm was elevated, his right arm. I think he took a hit to the rib cage, came back in the game, but he was grimacing. He was quite obviously in pain. I think it was about the third, fourth quarter. He went out, and the backup quarterback came in. What's going on there in Rodgers?
Yeah, so there's kind of a twofold thing with him. So the first part is this sort of rib or this abdominal injury. So he got imaging done. The concern a lot of times is there a rib fracture? We've seen this a lot in quarterbacks who get kind of wrapped up and the defender lands on him and kind of compresses it. And just think of it kind of like a barrel, a wine barrel, where, if it gets squeezed from the sides and the wood cracks, you lose the integrity. So if you have a rib fracture, that really makes it hard to move, to take deep breaths, to be able to kind of bear down hard enough to tighten your core and throw. So his imaging luckily came back that he didn't have a rib fracture, which usually indicates that it's some of the soft tissue between the ribs that have been injured. So that can be nearly as painful, and it can be limiting. He seems to be channeling his inner Ben Roethlisberger and sort of saying, hey, if nothing's broke, he's going to play. And that's kind of what he's been going through this season. One thing, Shannon, I wanted to touch on real quick is I think a lot of people have been noticing he's been nursing a thumb injury as well. And interestingly enough, this happened, I think, back in week 5. They've been kind of quiet about it. And just last week, he sort of, in one of his weekly radio shows, sort of brought up that, oh, by the way, it's a fracture. So it sounds like what he actually had was an ulnar collateral ligament injury and had a little avulsion fracture, which is where the ligament, sort of kind of like the MCL in the knee, it supports the base of the thumb. And so if that ligament is torn, that's obviously a problem. Sometimes it peels off with a small piece of bone, and you try to splint it and let it heal, but he's been trying to play through that. So that may, feed into a little bit about what, why his productivity and he's been kind of erratic on his throws and stuff like that all season. So he will be a play based upon everything we've heard so far. But kind of like Travis Etienne, he is really very hit or miss in his productivity from a fantasy standpoint.
Yeah, and the other thing I was reading, I think I read where they were talking about, with only 5 or 6 games left for the Packers. I mean, they needed a win. I believe it was on Monday Night Football. They really needed that win to kind of stay in the hunt. They may be out of it. So the backup quarterback, what's his name, Love? Is that right? I mean, yeah. And then they were talking about maybe getting him in. I guess they're looking at what is the future for Green Bay and maybe even Aaron Rodgers. I mean, he's always been a fantastic quarterback. But like you're right, he is just not throwing the ball with that thumb, and now these soft tissue injury. It sounds like it's like you said, a soft tissue, maybe one of those muscles, those oblique or intercostals that's irritated. But he's a play for right now, but keep an eye on him. Okay, Elijah Mitchell, San Francisco wide receiver. Boy, here we go. This guy's got an MCL. Sounds like a pretty significant MCL sprain.
Yeah, so he's a recurrent injury. So he actually sprained his MCL earlier this season and missed a substantial amount of time. So this is a repeat injury to that area. So we've talked about soft tissue healing, about how that ligament tends to kind of, peel off the bone a little bit. And by protecting it, it starts to stick back down again. So by recurrently injuring it, that tells us that the soft tissue, had not had a chance to sort of mature. And so he's going to be a sit. He's probably, I believe they're talking about putting him on IR and ending his season.
That's right. He's going to be out. He's going on IR most likely. They're talking about him being out 6 to 8 weeks. That's the season, so most likely he's out. So Elijah Mitchell, running back, San Francisco 49ers, is a sit probably for the remainder of the season. And so let's see here. Okay, here's one. We got to keep an eye on. He might need surgery. This is Darnell Mooney, Chicago Bears wide receiver. He's headed to IR, so it sounds like he has got a significant ankle problem, and his injury is most likely going to lead to him being out the rest of the season in IR. What do you know about Darnell Mooney?
Yeah, we've been touching on these injuries all season. He's another one. He's another one with basically a high ankle injury. So he's had that injury to that syndesmosis, that thick soft tissue that helps hold those two lower bones in your leg, the tibia and the fibula, together. So he's had enough of an injury there that probably based on the imaging that they've done between an X-rays and an MRI, that tissue is not stable. And he probably is showing some displacement or separation there that's beyond the criteria to consider leaving it alone to heal it. So they've been a little tight-lipped on exactly if he's having surgery done, but it sounds very much like that tightrope procedure that we've talked about before, where they may be going in and putting some suture material, some very heavy suture material between those two bones to hold them together in an anatomic position to allow that soft tissue to heal as close to normal as possible, but also give him the ability to start rehabbing it perhaps a little bit sooner. But you're exactly right, Shannon. They've put him on IR, so he's going to be an out and probably not playing for the rest of the season.
Okay, that's Darnell Mooney, Chicago Bears wide receiver, out most likely on injured reserve, possibly going for surgery for his ankle. So he is obviously sit athlete this week and probably the rest of the season. This guy is on fire. I mean, he's really kind of seems like he's boosted this team. This team is on fire, so to speak, also. Kind of San Francisco 49ers, man, do they have a defense or what? My gosh, I mean, everybody's back. Everybody's looking healthy. But Christian McCaffrey's got a patella tendonitis, one of these kind of aggravating, nagging type injuries. Let's talk about anatomically the patella tendon and the patella tendonitis aspect.
Yeah, so this is a pretty common problem that I'll see in my practice a lot. A lot of younger athletes get this. It's oftentimes considered a little bit of an overuse issue. So the patellar tendon is basically the rope that goes from the bottom of your kneecap and then attaches to the top of the tibia below it. So it's part of the sort of the whole function of your quadriceps to extend the knee. So when your quadriceps tightens up, it pulls through the fulcrum of the patella, through the patellar tendon, and it extends your knee. So when you have patellar tendonitis, it's usually a stress problem in the top part of the patellar tendon where it's attaching directly to the bottom of the patella itself. And it'll present with pain, it'll present with discomfort. And the concern sometimes is your body basically starts to break down a little bit in that area, and you actually get some interstitial tearing, so some microscopic tearing in the attachment, and that becomes a real nagging problem. It's not usually a risk that it's going to rupture or tear, but it just becomes so uncomfortable that anytime you try to do anything that loads the knee, you're weak, you're inhibited from doing things. So that is apparently why his workload has not been as high as a lot of people expected. He came in like gangbusters after the trade to the 49ers, but then his utilization hasn't been as high as a lot of people expected. So he's been a guy that's been nicked up. This is another nicked up type of injury, and I expect he'll play, but again, I think he's going to be a little compromised with regards to his productivity. But just like you said, Shannon, their defense is so good.
Yeah.
They probably don't need him to do much except get in the end zone one time.
Right, exactly. That patella tendonitis, again, we've talked a lot about these injuries that are kind of, sometimes they can linger. It's an inflammatory process. There's irritation of the soft tissue. A lot of times it's time or biology as we talk. With an athlete like him, obviously he's probably undergoing, some extensive and daily and probably maybe a couple times a day physical therapy treatment to try to decrease that inflammation, improve the function, decrease his pain, et cetera, et cetera. Now, from a medical standpoint, obviously, maybe an anti-inflammatory, he might be prescribed an anti-inflammatory, but you're not really inclined to inject that patella tendon. Sometimes, for our listeners, we hear a lot about how these athletes sometimes get these cortisone injections. Oh, they took them at halftime and, gave them an injection or something like that. This is not one of those situations. That's a weight-bearing tendon. Can you talk a little bit about that, how you make that determination to use cortisone?
Yeah, so cortisone is obviously, it's sort of used as an anti-inflammatory in a localized aspect. So, if you've got sort of like perhaps swelling within a joint, sometimes that's very helpful for that. We talked about guys getting their AC joint injected in their shoulder to be able to come back and play. But you're exactly correct, Shannon, that when you're looking at this, it's because that's a solid structure, the tendon. A lot of times the concern is that injecting steroid in there, one, it sort of displaces normal tissue because you're not actually putting it into an empty space. You're putting it into a solid structure. And there's some concern that actually weakens the collagen in that area and puts you at a higher risk of making the situation worse. So cortisone injections generally are not something that we'll do for a problem like that into a tendon directly. It's usually around a tendon, but in this situation, there's not really an area around it to put the injection into. There are some interesting usages of things like platelet injections and stem cell injections as perhaps a way to stimulate the body to heal that area. And so some athletes are doing that. The data is a little mixed as to whether that should be something that's done in season or really should be started at the end of the season when you're just focusing on rehabbing it and having it get better. So I'm sure there's a few athletes out there that'll bite the bullet and go for that in season. Thinking that, okay, maybe this will accelerate my healing. But again, if you're still loading it, I think that may be a little bit questionable. Yeah,
it's an exciting time to be in medicine. It really is, with all the biologics and the regenerative type procedures that are coming out. You're talking about PRP, stem cells. There's some really interesting stuff going on using biology to help heal these injuries. And I think the future is pretty bright for those chronic repetitive injuries that maybe just nag. Everybody just can be nagging, but I think there's some neat stuff going on the horizon. So Christian McCaffrey is going to most likely be in the lineup, but his output might be a little bit limited, so keep an eye on him. That's pretty much our athletes this week. Just as we wrap up here, I don't know if you know anything, or this guy just lit us up. The Seahawks just lit the Seahawks. I think 200-plus yards on the ground. Had an 86-yard run at the end of the game to win for the Raiders in overtime. But I didn't notice it. I didn't know he ran pretty well, but they're saying now he might have a little bit of a calf strain, and that's Josh Jacobs. And I assume he's going to play just because he didn't look really significantly impaired. He ran for 86 yards. Josh Jacobs, do you know anything about him?
Yeah, I think he had basically a medial gastrocnemius strain, which is the kind of classic calf injury. And I think you're exactly correct, Shannon, that because he was able to kind of maintain himself and, still put that much yardage in late in the game after the injury had occurred, that it's probably just a sort of a light strain, small amount of swelling in the fibers of the muscle. And they're probably just been resting him the beginning of the week, keeping him out of some things in practice, working on his flexibility. And I think he'll be a go.
Yeah, I think so too. Josh Jacobs, he'll be a go. If you had him on your team last week, you did well, didn't you? Anyway,
absolutely.
Yeah. Okay, here we go. That's week going into week 13. Thank you for listening. Good luck this week, and we'll see you next week to talk about the injuries and our Start or Sit podcast. Dr. Hawkins, as always, thank you so much for your time. Great information. Look forward to talking next week. Have a great day.
That sounds great, Shannon. You too.